That's right, Megan. UMMC is Mississippi's only level 1 trauma center and one of the 5 large hospitals in the state that hospital leaders say has no more ICU beds. This is happening at a time when we have one of the fastest growing COVID-19 case rates in America.
We are full. The vacancy light is off.
Dr. Luann Woodward is the Vice Chancellor of the University of Mississippi Medical Center. In addition to being the state's only level 1 trauma center, UMMC is the only facility with a pediatric hospital. They are also the only hospital capable of doing transplant surgeries and a list of other medical procedures people really need.
As you might imagine, patients are still in car wrecks, they're still having heart attacks, and they're still having strokes and all of those other things that we need to take care of and that we are taking care of.
All of this as they serve as the only research hospital in the state. And Woodward says that's on top of caring for COVID-19 patients, where the work is far from over.
As soon as we think we're going to get a breath, we don't get a breath.
Dr. Andy Wilhelm is the director of UMMC's Medical Intensive Care Unit. All of the beds in his unit are full. In fact, as of Tuesday, they are over by 29. Patients are waiting in the emergency room or other places for beds. And when one opens, it typically is not good news.
When a bed empties, it's not just because we were able to send that person home or to get them out of the intensive care unit. It's because they might have passed. So emotionally, being on that hamster wheel.
Wilhelm says the work is draining staff, both mentally and physically.
But when you're running full speed all the time and the outcomes are not always what you want, it's exhausting.
Dr. Woodward says what bothers her now, along with her colleagues in other states, is getting people to understand just how serious this virus is.
There's so much belief in the general population that it's not that bad. I can continue to go about my day as if nothing is going on. We are challenged in Mississippi with getting the message across around it is bad.
Now, Dr. Woodward says people need to understand by that embracing the responsibility of wearing masks along with social distancing, those tools position us to be in a better place to battle COVID-19 in the fall, when the impact of the virus is expected to be worse than what we're dealing with now. Troy Johnson, 16 WAPT News at 10.